Did you know that certain common medications can silently harm your kidneys over time? It's true. Let's find out how to protect them. Welcome to today's video where we will explore a crucial topic that affects many of us. How everyday medications can impact your kidney health and what you can do to safeguard these vital organs. We eat medicines to protect us, but in long term, these medicines are causing more damage to our vital organs and can reduce our body's natural fighting system. Medications like pain relievers, certain antibiotics, and even over-the-counter drugs can put your kidneys at risk. If you are worried that you may have taken some medicines and don't know if they have impacted your health, then you are at right place. In this video, we will talk about how kidneys function normally, how do they get affected by medicines, which common medicines affect your kidneys, are there any common symptoms to diagnose damaged kidneys at home, is there any treatment to reverse this damage? Let's get into it. The renal system consists of kidney, ureters, and the urethra. The overall function of the system filters approximately 200 liters of fluid a day from renal blood flow, which allows for toxins, metabolic waste products, and excess iron to be excreted while keeping essential substances in the blood. The kidney regulates the amount of water, solutes, and electrolytes in the blood. It ensures long-term acid-base balance and also produces erythropoietin, which stimulates the production of red blood cells. It produces renin for blood pressure regulation and carries out the conversion of vitamin D to its active form. Main organ of excretion is kidney. Glomerular filtration is the first step in the urine formation and constitutes the basic physiologic function of the kidneys. It describes the process of blood filtration in the kidney, in which fluid, ions, glucose, and waste products are removed from the glomerular capillaries. Next process is tubular reabsorption and secretion are important that occur in the kidneys to maintain the balance of electrolytes and fluids in the body. Tubular reabsorption occurs when the kidneys reabsorb useful substances such as glucose, amino acids, and electrolytes from the filtrate back into the bloodstream. The tubular secretion function is to dispose of substances such as drugs and metabolites. Hydrophilic drugs are typically directly excreted by the kidneys. Hydrophilic means having a tendency to mix with, dissolve in, or be wetted by water. The hydrophobic drugs that do not mix, get wet, or dissolve in water are first metabolized by the liver and then excreted by the kidneys. Now, what actually happens when certain medicines are taken? First on our list are NSAIDs, commonly known as painkillers. NSAIDs such as ibuprofen, naproxen, and aspirin work by exhibiting the production of prostaglandins, which are chemicals in the body that promote inflammation, pain, and fever. However, prostaglandins also play a key role in maintaining blood flow to the kidneys. By reducing prostaglandin levels, NSAIDs can decrease blood flow to the kidneys, reducing their ability to filter blood effectively. This can lead to acute kidney injury, especially in people with pre-existing kidney disease, dehydration, or heart conditions. Certain medicines, including NSAIDs, can trigger inflammation in kidneys. This leads to impaired kidney function. If not addressed, it can cause permanent damage to the kidneys. Long-term use of NSAIDs can cause chronic kidney disease. As NSAIDs can reduce the blood flow to the kidney, it causes repeated damage to kidney tissues. In short, chronic kidney disease is the gradual loss of kidney function. Some painkillers, particularly those containing aspirin, can increase the risk of developing kidney stones. Repeated stone formation can cause recurrent damage to the kidneys, leading to a gradual decline in kidney function. When painkillers are used in combination with other nephrotoxic medications such as certain antibiotics or diuretics, the risk of kidney damage increases. This is especially concerning in individuals with other health conditions that already compromise kidney function. NSAIDs can sometimes lead to fluid retention and decreased urine output, contributing to dehydration. Dehydration in turn can reduce blood flow to the kidneys, further increasing the risk of acute kidney injury. Misusing any pain medication can increase your risk of kidney damage. This includes aspirin, ibuprofen, acetaminophen, NSAIDs, and of course prescription opioid medications. The most common risks center around consuming too high dose or taking medications for longer than recommended. But of all the over-the-counter medications categories, NSAIDs pose the greatest risk of continuous kidney damage. Specifically, these medications can increase the risk of progressive kidney damage or sudden kidney failure. Certain antibiotics can damage the kidneys through several mechanisms, especially when used in high doses or over extended periods. The kidneys are responsible for filtering waste products from the blood, and when they are exposed to potentially harmful substances such as certain antibiotics, their function can be compromised. Some antibiotics are directly toxic to the kidney cells, particularly those in the renal tubules where reabsorption and secretion occur. When these cells are damaged, it can lead to acute kidney injury. Aminoglycosides, these antibiotics can accumulate in the kidney cells, leading to cell damage and necrosis. Some antibiotics can cause inflammation of kidney interstitium, which is the tissue surrounding the kidney tubules. This condition, known as interstitial nephritis, can lead to reduced kidney function. Penicillins, cephalosporins, sulfamethoxazole can trigger an immune response that leads to inflammation in the kidneys. Certain antibiotics can form crystals in the urine, especially if the patient is dehydrated or has a pre-existing kidney condition. These crystals can obstruct the renal tubules and lead to kidney damage. Some antibiotics can alter the blood flow within the kidneys, leading to reduced filtration rates and kidney damage. This can happen through various mechanisms such as construction of blood vessels supplying the kidneys. For example, vancomycin. This can alter renal hemodynamics and lead to nephrotoxicity, particularly at high doses or when combined with other nephrotoxic medications like NSAIDs or diuretics. The combined effect can overwhelm the kidney's ability to process and excrete these substances, leading to kidney injury. Proton pump inhibitors, commonly used to treat conditions like acid reflux, peptic ulcers, and GERD, that is gastric esophageal reflux disease. These have been linked to kidney damage through several mechanisms. While proton pump inhibitors are generally safe when used as prescribed, prolonged or inappropriate use can lead to serious kidney issues. One of the most recognized mechanisms by which proton pump inhibitors can cause kidney damage is through acute interstitial nephritis. This inflammation can impair kidney function and lead to acute kidney injury. Over the time, the inflammation caused by acute interstitial nephritis can result in permanent scarring of the kidneys, reducing their ability to filter waste from the blood effectively. Some studies suggest that even without preceding acute kidney injury, long-term use of proton pump inhibitors is associated with the increased risk of chronic kidney disease. The exact mechanism is unclear, but it may involve subtle, ongoing damage to the kidneys that accumulates over time. Long-term use of proton pump inhibitors can lead to hypomagnesemia, a condition where magnesium levels in the blood are abnormally low. Magnesium is crucial for many bodily functions, including maintaining normal kidney function. Low magnesium levels can exacerbate kidney problems, and in severe cases, hypomagnesemia itself can lead to kidney dysfunction. Proton pump inhibitors can also affect calcium absorption, which may indirectly impact kidney health, particularly in patients prone to kidney stones. These drugs alter the pH of the stomach, which can change the gut microbiome. This alteration can increase the risk of infection, which can indirectly affect the kidneys by causing dehydration and subsequent acute kidney injury. The altered pH and gut flora may also make the body more susceptible to urinary tract infection, which can potentially ascend to the kidneys and cause pyelonephritis, leading to kidney damage. Last but not least, diuretics. These are often prescribed to treat conditions like high blood pressure, heart failure, or edema, and can sometimes cause kidney damage, particularly when used inappropriately or in vulnerable populations. Diuretics work by increasing the amount of urine produced by the kidneys, which help reduce fluid buildup in the body. However, excessive loss of fluid can lead to dehydration and reduce blood volume. When blood volume decreases, the kidneys receive less blood flow, which can impair their function. Dehydration and reduced blood flow can lead to acute kidney injury, which is a sudden and potentially reversible decline in kidney function. The kidneys need an adequate blood supply to filter waste and maintain electrolyte balance. Without it, they can become damaged. There are different types of diuretics which function in different ways. Diuretics, especially loop diuretics and thiazide diuretics, can cause significant loss of sodium and potassium in the urine. Low levels of these electrolytes can disrupt various bodily functions, including those of kidneys. Potassium depletion can lead to muscle weakness, arrhythmias, and kidney problems. The kidneys need potassium to function properly, and severe hypocalcemia hyperkalemia can impair their ability to filter waste. Conversely, potassium-sparing diuretics can lead to high potassium levels, which can be dangerous, especially in patients with compromised kidney function. Hyperkalemia can cause arrhythmias and further stress the kidneys. Diuretics can lead to acute kidney injury by causing dehydration, reduced blood flow, and electrolyte imbalance. Acute kidney injury is characterized by rapid decline in kidney function, which can be detected by a sudden decrease in blood creatinine levels or decrease in urine output. Symptoms of acute kidney injury may include fatigue, swelling in the legs and ankles, decreased urine output, and confusion. If untreated, it can progress to more severe kidney damage and potentially chronic kidney disease. In patients with pre-existing chronic kidney disease, diuretics can exacerbate the condition by further reducing kidney function. The kidneys of these patients are already compromised, and the additional stress from diuretics can accelerate the progression of chronic kidney disease. Patients with diabetic kidney disease are also at higher risk of kidney damage from diuretics, particularly if the diuretics cause significant fluctuations in blood glucose or electrolyte levels. Diuretics can reduce the glomerular filtration rate, which is a measure of how well the kidneys are filtering blood. This reduction can occur because diuretics decrease blood volume and consequently the blood pressure in the kidneys. A lower glomerular filtration rate can signal that the kidneys are under stress and not functioning optimally. In some cases, diuretics can cause renal hypoperfusion, where the kidneys do not receive enough blood flow. This condition can damage the kidneys by depriving them from oxygen and nutrients, leading to ischemia and tissue injury. Some diuretics, particularly loop diuretics, can lead to calcium loss in the urine. Over time, this can contribute to the formation of kidney stones and a condition called nephrocalcinosis, where calcium deposits build up in the kidneys. Nephrocalcinosis can impair kidney function and lead to chronic kidney disease. The increased calcium in the urine can lead to the formation of kidney stones, which can block the flow of urine and cause pain, infection, and potential kidney damage. This is all about certain medications which can cause kidney damage. Now, what are the symptoms of kidney damage and how can we avoid them? When your kidneys are damaged, you will notice a decrease in urine production, changes in urination, including frequency, color, and amount, swelling in the legs, ankles, or around the eyes due to fluid retention, feeling unusually tired or weak, often due to buildup of waste products in the blood, shortness of breath caused by fluid retention, and in severe cases, fluid in the lungs, increased blood pressure due to fluid retention and decreased kidney function, nausea and vomiting caused by the buildup of waste products and toxins, confusion resulting from severe kidney dysfunction leading to an accumulation of toxins in the bloodstream, blood in the urine due to damage to the renal tissues or blood vessels within the kidneys, fever and rash, which is the symptom of acute interstitial nephritis, which can be triggered by an immune response to the antibiotics, back or flank pain, which is the discomfort in the area around the kidneys, muscle cramps or weakness, excessive thirst and dry mouth, dizziness or lightheadedness, especially when standing up as a result of low blood pressure and dehydration. If you or someone you know is taking these medications and experiences any of these symptoms, it's important to seek medical attention promptly. Early detection and management of kidney damage can prevent progression to more severe conditions like chronic kidney disease or kidney failure. Regular monitoring of kidney function through blood tests and urine tests is crucial, especially when using these medications over a long period. Firstly, avoid the use of any drug for the long term. Use them under doctor's guidance. Avoid over-the-counter medicines. Keep yourself hydrated while on any medication. Ensuring adequate hydration can help prevent crystal formations and maintain good kidney function. Symptoms of kidney damage can be subtle and often go unnoticed until significant harm is occurred. It's essential to have regular checkups with your healthcare provider, especially if you take medications that could affect your kidneys. Staying hydrated is also crucial as it helps your kidneys filter waste more effectively. To wrap up, remember that being informed and proactive can help protect your kidneys from medication-related damage. Keep track of the medications you are taking, understand the potential risks, and always stay hydrated. If you found this information helpful, please like, share, and comment below with your thoughts. And don't forget to subscribe and check out our next video. Thank you for watching.